Hello, and thank you for joining us for Dallas Theological Seminary's Ergonomics training. We hope you enjoy this video and learn something new about how to move and interact with your environment more safely. Ergonomics is an applied science concerned with designing and arranging things people use so that the people and things interact most efficiently and safely. Applying ergonomics to your work helps prevent musculoskeletal disorders, like injuries to muscles, tendons, nerves, joints, and bones. It can also increase your productivity and keep your muscles from getting tired for a while. The musculoskeletal disorders that we are going to cover in more detail in this presentation are back injuries, wrist injuries, including carpal tunnel syndrome and tendonitis, stenosing tenosynovitis, which affects the fingers, and epicondylitis affecting the elbow, and shoulder injuries involving the rotator cuff. Some quick examples of poor ergonomics are poor posture or awkward posture, which affect people who work at desks a lot, exerting excessive force and heavy lifting, which is key for those of us working in receiving areas and maintenance, performing repetitive tasks, and static posture, which is big for administrative positions, and bending and reaching overhead, which can happen with a lot of maintenance. General tips for improving your ergonomics include trying to maintain good posture when seated or standing, asking for help with lifting heavy objects or repetitive tasks, taking breaks by trying to change positions, stretching, etc., alternating work activities, give different areas of your body a break, using equipment that might reduce your risk, like using a dolly to carry heavy objects or using extension poles or a higher ladder so that you don't have to stand with your hands over your head. Also change positions to avoid straining one part of your body and push rather than pull heavy loads. After that brief overview, you might be asking, why is this training important? First is because these types of injuries are common. 20% of all occupational injuries is very significant. Second, these injuries can impact all aspects of your life. If your spine is injured, even things like breathing and laying down can be painful. If your hands, wrists, or elbows are injured, everyday activities like driving, eating, and getting dressed can be difficult. These injuries won't just affect your work, they will affect everything. Third, these injuries do not heal quickly. They often require surgery or physical therapy, and even then, the consequence of the injuries are likely to follow you and are likely to worsen throughout the rest of your life. So take this seriously, even if you don't notice the irritation to your body right away. So first, we're going to look at the spine. It's the first system we're going to look at. It protects your spinal cord, which consists of the nerves that communicate between your brain and the rest of your body. It's made up of 33 bones called vertebrae, which are held together and cushioned by spinal discs and moved by a network of back muscles. The 7 cervical vertebrae in your neck support your approximately 11-pound head and allow you to move, tilt, twist your head in many directions. The 12 thoracic vertebrae in your torso support your ribs and protect your internal organs by allowing only limited flexibility and movement in this area, which is good. The 5 lumbar vertebrae, which make up your lower back, carry the most body weight and allow for flexibility of movement. This is also the easiest part of your back to injure, as you might imagine. The 9 vertebrae that are fused together in the sacrum and coccyx, the very base of your spine, attach to your pelvis and move your spine in coordination with your hips. Also, note the curve of your spine. The neck is straight. The area of the shoulders curves towards the back and then moves into a forward curve with the lower back before curving backwards again in the hip area. The least strain is placed on the spine when you stand or sit in a position that allows the spine to maintain this natural curve. And we'll talk about more about what good posture looks like keeping this curve towards the end. The spine, like other joints, are affected by repetitive or extreme motion. These activities put extra strain on the spine and its discs, nerves, and muscles. putting you at risk for spinal pain and/or injury. Back injuries are some of the most difficult musculoskeletal injuries to treat. Sometimes physical therapy is all that is necessary, but injection treatments and eventually surgery are often required. Next, let's look at hand and wrist anatomy. Your hand can twist and bend in nearly all directions through the coordination of the bones, nerves, tendons, and ligaments that make up the wrist. Carpal tunnel syndrome occurs when the median nerve is pinched by inflammation occurring in the other wrist tissues. As the other tissues swell up due to inflammation, this closes in on the median nerve that runs through the middle and can cause pain, numbness, and loss of strength in the wrist and fingers. Wrist tendinitis, another disorder, is caused by small tears in the wrist tendon, which causes symptoms very similar to carpal tunnel. So a full evaluation by a medical professional is necessary to determine which wrist disorder is present and the appropriate course of treatment, which may include rest and bracing of the joint or injection treatments and surgery depending on the severity. Your fingers that we'll look at are able to bend and straighten in careful and precise movements through the coordination of bones, nerves, tendons, and ligaments which extend through each finger. Injury to any part of the finger can limit mobility and dexterity for the affected individual. Conditions like tenosynovitis or trigger finger can be caused by repetitive or forceful movement of the fingers or thumb over a long period of time. These movements cause inflammation in the A1 pulley, which the flexor tendon guides through whenever your fingers bend. This inflammation makes it difficult for the tendon to move smoothly when your finger is bent. And it may result in the formation of nodules on the tendon, which increases the difficulty of bending the finger and straightening. These nodules may result in a sensation of sting or popping when the finger is moved and can be unpleasant and painful. Depending on the severity of the injury, treatment can range from rest and splinting to medications, injection treatment, and surgery in more severe cases. Now looking at the elbow, a hinge joint formed where your humerus connects to your radius and ulna bones in your forearm, we also see a number of muscles and ligaments that work together to bend the arm and are also responsible for the stabilization and extension of the wrist and fingers. This means that movements you do with your wrist and fingers affect your elbow joint. Repetitive motion injuries in the elbow are common for athletes, painters, plumbers, and carpenters, among others. Small tears in the extensor carpi radialis brevis, or ECRB muscle, are largely responsible for pain in this area of the body. Injuries are thought to be caused by repetitive bending of the elbow joint and by doing tasks that require one to keep the wrist stable while applying force, and painting is a great example of this. Repetitive contraction and extension of the hand and fingers is also implicated in the causes of elbow injuries. Common symptoms of tennis elbow include pain or burning on the outer part of the elbow, weak grip strength, and unexpected pain at night. Symptoms develop slowly and typically worsen over time if the joints are not able to rest. Depending on when the injury is first stressed, treatment may involve rest or bracing of the joint, or up to more invasive procedures like injection and surgical treatment. Finally, the last joint we will be specifically addressing in this training, the ball and socket joint of the shoulder. It is formed by the intersection of the clavicle, scapula, and the humerus bones and associated tendons, ligaments, and muscles. The rotator cuff is comprised of the tendons and muscles that work together to hold your arm in this joint and allow it to move. Because there is very little blood flow in this area of the body, shoulder muscles and tendons are particularly susceptible to degeneration with age. As this happens, they become more susceptible to injuries. Repetitive motions, lifting the arms over the head, lifting heavy objects with extended arms, or trying to catch heavy falling objects are typical sources of rotator cuff injuries. Tenderness and soreness in the shoulder is often the first sign of injury, and damage may progress to a point where it is difficult to sleep on the affected shoulder. Rest and physical therapy can successfully treat a mild rotator cuff injury, though surgery may also be necessary in severe cases. So, are you at risk for one of these injuries? People who carry heavy objects, are overweight themselves, sit or stand in one position for long periods of time, hold their phone on their shoulder, wear unsupported footwear, bend or reach for objects frequently throughout the day, and regularly lift children or heavy boxes are at a greater risk for musculoskeletal injuries caused by bad ergonomics. You may have noted by this point in the presentation that the everyday tasks you perform in your job as part of the facilities and plant operations teams puts you in a high risk category for these injuries. So, how can you reduce your risk? When you are seated at your desk, sit upright so you are able to keep your shoulders directly over your hips. Keep your feet flat on the floor or flat on a footrest. Keep your arms bent at a 90-degree angle while working. Ensure that the top of your screen is at eye level so that you are always looking slightly down at your screen, not up. If you believe your desk is not set up for you to sit ergonomically, let your supervisor know and they will be happy to arrange for adjustments to be made. And even if you have the perfect setup, you still don't want to stay in one position for too long. Make sure you stand up, walk around, and stretch at least every 30 minutes to maintain blood flow throughout your body. When walking or standing, stand or walk upright. Keep your shoulders square, not rounded, and keep your shoulders directly over your hips. Then walk or stand, keeping your feet shoulder width apart. Finally, maintain a comfortable stride while walking and avoid distractions like looking at your phone to avoid the risk of falling. When picking up heavy objects, first assess the size of the load and get help or mechanical assistance if it is needed. Make sure you have a clear path to your destination by clearing away objects and be sure that you can see wherever you are going. Stand close to the object to be picked up with a wide stance, keeping your feet at least shoulder width apart. Bend with your knees, not your waist. Bring the object as close to your body as possible. Finally, before lifting, tighten your stomach, lift your head to see what is in front of you, and rise using your legs. If you need to pick up a bag, squat next to the bag and grab it at opposite corners. Begin the lift by bringing up the bag to your thigh or waist. Finally, stand and move the load onto your shoulder. Be sure to stabilize the bag as you walk, as carrying unusual loads like bags can cause your center of gravity to shift in unexpected ways. As you are walking with the heavy box, bag, or other object, make sure you can see where you are going. Take small, stable steps and do not bend or twist your back while moving. If the object is heavier than you can safely move by yourself, team lift. To do this, gather your coworkers to help you, designate a person to lead, and be sure to lift at the same time. Then keep the load level as you move, and slowly put the load down together when you have arrived at your destination. When doing work that requires repetitive motions, take breaks frequently. Make every effort to relax in positions that do not restrict blood flow to your joints. Change tasks and positions to alternate which muscle groups are working, and when possible, use tools to minimize strain on smaller or more vulnerable joints. If you are doing work overhead, use a ladder of the appropriate height to minimize reaching. Take breaks and do activities that increase blood flow to your shoulders, elbows, wrists, and hands by moving your arms to a height below your heart. When possible, use tools like extension pulls, which allow you to keep your arms in a position lower and closer to your body. If you feel that you do not have the tools to do your job safely, please alert your supervisor, who will work with facility support to find you the most appropriate solution for all your ergonomic needs. It is your supervisor's responsibility to be looking out for and helping to correct any safety issues that arise in your department. And it is your responsibility to alert your supervisor to any work conditions that appear unsafe. Remember to always choose safety over independence. God did not design us to do our work alone, so reach out for help whenever you are even slightly unsure. Finally, be sure to look out for your coworkers too. Volunteer to work together with them on heavy loads and keep an eye out for small details that can make a situation less safe than it appears to be. This concludes our ergonomics training video. Stay safe and thank you for watching.